Hello doctors. In this video, we will be covering the topic diabetes mellitus. We will cover these questions. Difference between type 1 and type 2 diabetes mellitus, pathophysiology, clinical features, risk factors, how to diagnose whether it is type 1 or type 2 diabetes, complications, signs of trouble that is emergency situation, insulin and about oral hypoglycemic agent. So, let's start with what does diabetes mellitus means. In diabetes, there are two common conditions seen. First, when pancreas does not produce insulin at all, or insulin is produced but body cannot effectively use the insulin. Okay, so let's start with small and simple things which we should know about type 1 and type 2 diabetes mellitus. Type 1 diabetes is autoimmune disease, type 2 is metabolic disorder. In type 1, your body is no longer able to produce insulin. In type 2, your body still produces insulin but it doesn't make enough use of it. Type 1 occurs in age less than 40 years, mostly in young children or teens. Type 2 occurs in age more than 40 years. Mostly it can occur in teenage with overweight and obesity. Causes of type 1 are family history, environmental causes. Certain virus promotes autoimmune disease like rotavirus, mumps, cytomegalovirus. Type 2 causes includes obesity, low physical activity, high diet in sugar, family history. Ketoacidosis, it is more common in type 1. Okay, now let's see its mechanism in detail. Here in this picture, we can see type 1, no production of insulin at all. While in type 2, there is insulin but body is unable to use because body is now rid of that person's lifestyle and eating habit. Making it more clear, in this picture, as we can see, pancreas with no insulin, but because as we eat food, there is glucose production in bloodstream. But muscle is unable to use this glucose due to low insulin. While in type 2, there is insulin also and glucose also. But due to our lifestyle changes, muscle is unable to use glucose. Body is not allowing insulin to work. Moving further, let's see signs and symptoms of diabetes, which includes polyuria, frequent urination, polyphagia, excess hunger, polydipsia, excess thirst, tired, lethargic, headache, dizziness, leg cramps, blurred vision, mood swings, irritability, wounds heal slowly, skin infections, weight loss in type 1 and weight gain in type 2. Sometimes type 2 patient shows hyperpigmentation or brownish skin thickening, especially on neck and armpit, known as acanthosis nigricans. And type 1 children may sometimes show symptoms of bedwetting. Now let's see risk factors leading to diabetes. Type 1 risk factors could be family history, genetics or age related. Besides this, in type 2 risk factors are weight, that could be due to overweight. Physical inactivity. Physical activity helps you to control weight. Uses of glucose as energy and makes your cell more sensitive to insulin. Strong family history of type 2 diabetes. Pre-diabetic. Here, blood sugar level is high but not enough high to classify as diabetes. Gestational diabetes. Fat distribution, which includes obesity, irregular diet, fatty foods, age more than 45, PCOS, high BP, high cholesterol can also cause type 2 diabetes mellitus. Now, a very big question, how to diagnose whether it is type 1 or type 2 diabetes mellitus. First, based upon symptoms, as we learned, most of the symptoms are almost similar of type 1 and type 2, but they present in very different ways. In type 1, symptoms develop fast, typically over the course of several weeks, but many people in type 2 won't have symptoms for many years. They develop slowly over the course of time. Some people with type 2 have no symptoms at all until complications develop. This one was based on symptoms. Now let's see about diagnostic test, which we usually do is glycated hemoglobin test, BSL random, BSL fasting and glucose tolerance test. Normally HbA1c, that is glycated hemoglobin test, is below 5.7%. If it is between 5.7 to 6.5, it is called as pre-diabetic, that is chances of diabetes in future. And if it is above 6.5, the patient is diagnosed as diabetic. BSL random, normally 70 to 115 mg per deciliter, above 200 is diabetic. Fasting below 100 normal, 100 to 125 pre-diabetic and above 125 diabetic. Similarly, glucose tolerance test 140 normal, 140 to 199 pre-diabetic, and above 200 patient is diabetic. Now, there are also few more tests which we should know. First, GAD, glutamic antibodies decarboxylase test. This test will help us to distinguish between type 1 and type 2 diabetes mellitus. Ketone bodies test. Ketone bodies are breakdown of fat. Presence of this in urine could be suggestive of type 1 rather than type 2 diabetes mellitus. Along with this, having our cholesterol level, thyroid, liver, renal function normal is also important. So, test related to this is also suggested. Now, I would like to tell this important thing about cholesterol. Our total cholesterol level should be less than 200. Triglyceride level less than 150. LDL less than 100. HDL are only happy cholesterol in our body. It should be more than 40. Now, let's see complications leading to diabetes, which includes diabetic ketoacidosis, diabetic neuropathy, diabetic nephropathy, diabetic retinopathy, atherosclerosis, stroke, hypertension, coronary artery disease, gangrene, foot damage, skin infection. In pregnancy, there could be risk of miscarriage, stillbirth, birth defects. Now, most important slide, signs of trouble, in which first there is hyperglycemia, BSL more than 200, hyperglycemic hyperosmolar non-ketonic syndrome, in which BSL is more than 400 or even more than 600, with dry mouth, dark urine, confusion, drowsiness. Similarly, in DKA, diabetic ketoacidosis, frequent urination, vomiting, shortness of breath, fruity, smelly breath. And lastly, hypoglycemia due to skipping meal, taking more medication. These are all emergency situation. And now, very last, treatment. Let me tell you, there is no prevention method in type 1. Patient is on long-term insulin. In type 2, it can be prevented by lifestyle modification, healthy living, oral hypoglycemic agent, and with insulin support. Now, let's see about insulin. Short acting, rapid acting, intermediate acting, and long acting, in which long acting and intermediate acting is typically used to maintain low and steady level of insulin in your body throughout a day. Rapid and short acting is used to provide a surge of insulin at mealtime. It can be used to correct high blood sugar level. Short acting examples are Humulin, Novolin R, rapid acting, insulin aspart, Novolog, intermediate Humulin N, Novolin N, and long acting example Lantus. Now let's see about oral hypoglycemic agent. It includes metformin, sulfonylureas, meglitinides, thiazolidinediones. Metformin, first drug of choice. It works by lowering glucose production in liver and improving your body's sensitivity to insulin. Sulfonylureas, it helps your body to secrete more insulin. Meglitinides, it works like sulfonylureas by stimulating the pancreas to secrete more insulin. Thiazolidinediones, it works like metformin, make the body's tissue more sensitive to insulin, but side effects are more, increases risk of heart failure and anemia. Hence, metformin is used as a first drug of choice. Other medicines, let's see about other medicines. Other medicines could be ACE inhibitors. It keeps your kidney healthy. It is used in the patient with both hypertension and diabetes mellitus. Aspirin to protect your heart. Cholesterol lowering drugs like lovastatin, pravastatin, and along with this, eating healthy and having physical activity. Thank you for watching. Hope you like this video. Do share your views. Keep watching. Thank you.